Good morning, welcome to Happy Toe Tuesdays. My name is Marty Hauptfleisch and I specialize in foot care. And if you have any questions, just leave it below in the comment section, or you can subscribe to my channel. Today we're talking about venous vascular disorders, and specifically acute venous vascular disorder. Now, I know this disease very, very well, and I'll tell you why. My mother actually had a C-section and I was born because of this disease. I recall her being in hospital 3 months of the year because this was such a big problem for her. And the one reason why you would get deep vascular disease is because there's a heredity factor, which I think would be her first line, why she got it. Because your veins are not as strong, and what happens is the blood clots, it can't return to your heart. So your heart pumps out blood, it supplies the whole body, and then through your artery supply, and then venous backflow goes back into your heart. And what happens, your valves don't function as well, and the blood just sits. So now you can see heredity can have a factor. If you're smoking, it really makes it hard for the blood to return because there's vasoconstriction. You know, the vein gets constricted because of the smoking, and it actually affects your circulation for 4 hours and even longer. So when I have a smoker, I'll tell them only smoke 1 cigarette every 4 hours because that's what your body can afford. So usually then they stop smoking. So this, and another factor would be if you're very inactive. So let's say you have a job where you're always standing, especially guards, jail guards, or when you're traveling a lot, you're sitting in your car a lot, or you're flying a lot. You're just that inactivity where you're just sitting goody two shoes and not doing exercises by moving your feet and pumping your calves. That means that the blood is standing in one spot, and what happens? It clots because your blood is meant to clot if it stands stationary. And then what happens with the clot, it obstructs the flow, and the vein becomes inflamed, and also the clot becomes inflamed. So then you get thrombophlebitis, thrombosis and phlebitis, and usually that's why it's sort of a term that they use, both of them, thrombophlebitis. And this is a problem. So if you have a foot and you're in bed, how can I show this? If you have a foot and you flex it, it's very painful if you have a clot in your calf. Okay, so that's the Homan sign. It's not always accurate in terms of, you can misdiagnose it because it won't always show, but that's usually a good idea. And if you lift the foot, it will be very painful. Some people say pumping the calf and then flexing, and it's a woo, you know, jump through the roof type of pain. So yes, it's very painful. And what usually happens is they come get you, they drive you to the hospital directly in ICU, put you on blood thinners to make sure that the clot dissolves, and yes, watch over you until your blood circulation has normalized. And yes, so the other signs that you can see is obviously if the circulation is affected, it will be red and swollen and be very painful, especially if you're walking. So so how do you treat this? It's easy to treat if you had a role to play. Stop smoking, be more active, exercise your feet, make sure you drink enough water, especially when you're traveling. So all the air hostesses coming past with their drinks, water, I mean, not alcohol, because that'll dehydrate you more. Coffee will dehydrate you more. Just make sure that you drink enough liquid. And as I was saying earlier today to a patient, if you drink liquid, you have to go to the bathroom, and what's that? That's exercise. So just be aware of it, and also building in space in your day to be active and to be at rest. For example, if you stand all day, make sure that you walk a bit, or if you walk all day, make sure that you lift your feet. If you lie for a long time or stationary, to make, you know, it's just whatever you're doing normally to change that, so that you get fresh new blood in your body, and this will prevent venous vascular disorder. But it is a medical crisis when it's acute. You cannot solve it on your own. You must be aware of your risk factors. So I know for my mom, when she travels far on an airplane, she'll actually have blood thinners for a trip to make sure that she's okay and don't get clots on in her travels. And it's a big thing, you know. Why? Because if that clot dislodges, it travels all the way up through your heart and goes and sits in your lung or anywhere else. It can obstruct the normal functioning of the body, and you can actually die. And what you also get after surgery, this is also a high risk that they look out for. That's why when you get surgery, they will have special, well, it's not really socks, but exercise socks they put on your legs to make sure that your calves are pumped during the surgery and afterwards, so that you keep normal circulation even though you're inactive during the time of surgery. So there you go. It is a big thing, and you have to make sure that you see the doctor as soon as possible. What they will do is they'll do a Doppler, which is just like, you know, normal how they look at the baby, is put some gel on and a little eye that looks and to see if there's a clot and what they're going to be doing. So it's very quick, and it's worthwhile just to check it out and to know what the real problems is. I hope that helps you. If you have any questions, just leave them below, and I'll speak to you next time.